Okay, it looks like we're ready to get started. Thank you again for joining us and taking the time to learn more about Dr. Jessica Rich's new practice. Before I turn things over to Dr. Rich, I would like to take a brief moment to introduce myself. My name is Julie Scott. I'm a transition manager with Monarch, where I support physicians through their transition and new practice setup, including Dr. Rich's. Just to share a little bit about Monarch, we serve as the support system behind the scenes, managing the operational and administrative details so that physicians like Dr. Rich can focus on what they do best, which is taking care of patients. I'm very happy to be here with everyone today. And with that, I will turn things over to Dr. Rich.
Thank you, Julie, and thank you all so much for joining me tonight. I know everybody's got busy schedules, busy lives, so I really appreciate you taking the time to be here tonight. I am so excited to talk with you all about why I decided to make this change, how my new practice can benefit you, and get into some of the details of how membership will work and what's included. So let's jump in. So, as most of you know, I've been caring for women with complex gynecologic issues for over a decade. So, this can be anything from perimenopause to menopause, pelvic pain, abnormal bleeding, fibroids, endometriosis, PCOS, and more. And so many of the people that I see have been dismissed by the medical system. They've been told that they're fine or that they're imagining their symptoms, that it's just part of being a woman and they should just basically suck it up. Or even worse, sometimes they're just completely ignored. I really love taking the time to connect with my patients, to figure out what's going on. And I love it when my patients tell me that they finally feel heard, that they are understanding their bodies sometimes for the first time, like never before, and that they finally feel hope in our plan for moving forward. Now, I do this to the best of my ability in the current insurance-based system, but there are a lot of limitations that the insurance-based system places on care. It really requires short visits, usually only about 10 to 15 minutes. And that means that there's limited time for when I can really get into what's going on and explain what's going on. I do my best to work around this, but that usually means that the next patient is waiting a little longer. And then these wait times get longer and longer, and it's really unacceptable. There's also significant administrative burdens and fragmented follow-up and difficulty with access and getting new appointments. So it really places a lot of limitations. This is not really how thoughtful, evidence-based women's healthcare should feel, and I think that you deserve more. Your feedback to me has also significantly influenced my decision. I am often hearing about patients who are asking for more time, more direct access, help navigating complex healthcare decisions. So I wanted to imagine what that healthcare might look like, and I want you to imagine it too. So just think for a minute. Imagine you're walking into a quiet, calm, beautiful office that feels like a space that's there for healing from the start. It feels more like a spa than like a medical office. You're greeted warmly, and the focus is all on you. In no time, you're sitting comfortably with me, fully clothed, and we're discussing your health. We're discussing your life goals and what your concerns are and what's important to you. If needed, of course, we'll do an exam, we'll do whatever procedures that we need to do. But then we get to sit comfortably again and go over what's going on, put all the information together, figure out next steps, and make a plan together. You would leave with all of your questions answered and the clarity that you need for the direction to take forward with a follow-up plan. So that's what I'm envisioning for you, and I hope that you can see that too. This decision was not made quickly or lightly. It's something I've been thinking about for years. I am deeply appreciative to all of you and the trust that you've placed in me. And many of you I've been taking care of for many years. Some we have a newer relationship, but I still appreciate your trust. And I understand that people likely have some mixed reactions to this decision. Some of you may be just as excited as I am. Some of you very curious. Others may have some hesitation or disappointment. And all of this is why I wanted to really take the time to sit down with you all face to face and to be able to talk about what's going on. My goal in opening up Enriched Gynecology, that's the name of the new practice, is really to create a space for more meaningful, proactive, and personalized care. This will allow me to protect the ability to practice medicine in a way that better aligns with my values in the long term and better serves you. So let's talk a little bit about what the new practice provides. So basically, a membership-based model simply means that I limit the number of patients that I care for so that I can spend more time with each person. This means easier access when questions come up. This means staying closely involved with your care throughout the year rather than just rushing through a short one-time visit. The 10-minute annual exam is really not enough for most people. What's not changing is my commitment to evidence-based medicine and clinical rigor and my commitment to you. This new practice, though, is the one that I've always wanted to build for you. Care that's calm, clear, connected, and very intentional. And this is what you all deserve. Many of you have already asked me if my practice is a good fit for you, and I think that's a valid question. And the truth is, it's not always a good fit for everyone. Now, honestly, I think everybody deserves this level of care. But I understand that it may not be what fits into each person's lifestyle at the moment. It's really for women who want a different level of care. It's beneficial to women who are navigating more complex or changing health needs. Anyone who has ever felt rushed, dismissed, or left managing symptoms on their own. I really see this as a great fit for those of you who I've been taking care of with fibroids, endometriosis, PCOS, pelvic pain, abnormal bleeding, and those who I've cared for in perimenopause and menopause and dealing with the many transitions and changes that your bodies go through in that moment. It's also a great fit for anyone who values continuity, proactive care, and prevention rather than just checking off that box of an annual visit. We'll talk more about these benefits in just a moment, but I do want you to encourage you to kind of think about a few questions as we chat tonight, and then, of course, beyond this webinar to think about them further. The main three questions that I want you to ask yourself when you're considering whether this might be the right fit for you is, do I want more time with my visits? Do I want easier access when questions come up? And do I want a long-term partnership with my physician rather than brief episodic care? Now, for some of you, your needs may be straightforward. For especially some of my young and healthy patients, maybe the traditional model may still work if you really just need that annual visit. But my goal is really to offer care that feels more thoughtful, unhurried, and truly supportive for the women who need it. So let's talk about what this looks like. More time together really means that we can have unrushed appointments where we sit and speak about all of your concerns, things that maybe you felt too scared to bring up in the past, or you've just felt like maybe it wasn't as important and you didn't have time to deal with it. We'll have more direct access, as I talked about. That means that if you have questions that come up, you don't have to go through 10 different phone trees to try to get to me. We have more direct access to each other to communicate and better follow up instead of just these one-time visits. The scheduling will be easier. You won't be waiting months to see me. You won't be waiting hours when you get into the office. This is really about restoring a stronger doctor-patient relationship. During your visits, we'll have a conversation about your goals, your priorities, your symptoms, your questions, without being interrupted, without being rushed. And we'll do this, like I said, all fully clothed and in a comfortable environment. This new model really gives me the ability to listen more deeply, to think more thoroughly, to follow up more consistently, and to truly partner with you in your health and what feels meaningful and supportive to you. So, as we talked about, with this more time together, This really means that we can be more proactive, more personalized, and more continuous instead of just being rushed, reactive, and episodic. It's not just going to be like, let's deal with the one thing in front of us today. Of course, we want to deal with the one thing in front of us today, but we also want to see, well, how is this going to affect you in the long term? What's coming up for you down the road, months from now, even years from now? And what are your short and long term goals and priorities? This is going to be not just when it comes to your health, but when it comes to your life, because your health can't be separate from your life. It all fits in together, and we want to take an approach that works with your life. So, the healthcare is just so much more than just this annual visit, this annual pap smear, or getting a mammogram. It's really about extending your health span and improving your overall quality of life. To do that, we really need to go deep and personalize your care. We're going to talk about a lot of things that are involved in the membership, but the truth is, everybody's membership is going to be a little bit different. There's definitely some baseline things that everybody will need, but each person's individual plan will be directed at their specific individual needs. And what I can promise you is that I will always keep you informed of what's happening, why, and what to expect, and how we're going to follow up next. As those of you who've been my patients for a long time know, I am truly passionate about developing a partnership with you and empowering each one of you to take control of your health and of your life, and to do this with clarity and evidence-based medicine. Lastly, I wanted to talk about how this new model provides much better patient support experience. So, as Julie mentioned, I've partnered with Monarch so that I can focus my time and energy where it belongs, on the medicine, on you, and on your care. With the Monarch team, you can expect to work with them on administrative items, things like scheduling support, claims submissions, medical record retrieval, and connecting with our virtual after hours urgent care as needed. I know healthcare can sometimes feel very complex, and there are so many barriers in the traditional healthcare system, but this is going to make things feel so much simpler, so much easier to navigate. And of course, you can talk with my team about any questions you have related to the membership. So let's talk a little bit about what the membership includes. Of course, all of the routine care things that you've been doing is going to be included. So yes, we will be doing the pap smears and getting your mammograms and your bone densities. But there's also going to be more comprehensive health assessments based on your needs. Do we need to do more of a cardiovascular assessment? Do we need to do more in-depth cancer screenings depending on your personal and family history? There's going to be complex condition follow-up. So whether that might be labs or ultrasounds or checking in a little bit more regularly. I'm going to be using a Sika body composition scanner that's going to help me get a better idea of what your muscle mass and fat mass looks like, and how we can make adjustments to work on that if we need to. We'll also be doing office procedures as needed. So things like colposcopy or LEEP or diagnostic hysteroscopies. These can be done in a more comfortable environment in the office, and much of that is included in the membership. There'll also be access to the more complex surgical procedures that need to be done in the operating room, and we'll talk a little bit more about that as needed too. I'm also really excited to offer some new benefits. In addition to that Sika body scanner that I mentioned, I'll be offering treatments like the V-Tone and the Morpheus, which can help with things like genitourinary syndrome of menopause or lichen sclerosis, and help to strengthen the pelvic floor. This, I know a lot of you have asked, is this a replacement for the laser? It is, and much more than that. So it's a technology that can do the things that the laser can do and more. And this is all included in your membership as well. So let's talk a little bit about the details and logistics. So my last day at the Florida Center for Urogynecology is March 18th. If you decide that you want to stay at the Florida Center for Urogynecology, you will be fully supported in transitioning your care to another qualified provider within the practice. And I will do my best to help ensure that transition is smooth, and they will provide guidance on the next steps. And Ritch Gynecology, my new practice, will open doors on April 1st. And this is going to be located in the Lena Medical Center at Aventura. It's just a couple of blocks north of Aventura Hospital and a few blocks north of the mall there. My practice will have a limited number of patients to protect access and to protect quality of care so that I can deliver on all of these things we've been talking about. This is an annual membership, so it's designed to give you ongoing access to me throughout the year so that we can monitor your health and adjust care as needed and stay connected. Your membership covers a lot of the things that we discussed already, including comprehensive gynecologic care and most in-office needs, with easier scheduling, direct access, and thoughtful follow-up. Membership is $5,000 for the year, but I am offering a founding members rate of $4,000 if you enroll before February 16th. If you are a member and you do need those more advanced surgical services, then you will receive a 50% off my professional fees across surgical services, and your membership will cover the consult fees. I'm also happy to see your daughters that are under 26 without a membership. So I know I see a lot of you as families. I see mom and all the daughters and sometimes grandma too. So for those of you moms who are members, if you have young daughters that maybe don't have as intense needs as would be considered for a full membership, but want to do their annual exams or brief GYN visits, we can do that for a simple out-of-pocket fee for the visit rather than a membership. Okay. There is no pressure to decide immediately. I want you guys to all really take the time to think about whether this is the right fit for you. Think about the three questions that I mentioned earlier. And always, if you have more questions that come up, of course, we're going to have the Q&A today, but if things come up after the webinar, you can get additional details and do a one-on-one consultation with one of my team members from Monarch.
Thank you so much, Dr. Rich. Before we move on and open up for Q&A, I do want to add, if you dialed in tonight and you have made the decision to join the practice, feel free to call us at 786-228-4284. We do have membership specialists available to speak with you and assist you with your enrollment. Otherwise, I want to cover just a couple of things before we move on. You'll notice there is a QR code here. That will take you directly to a link where you can schedule a 15-minute consultation with a membership specialist. If you have questions that are very specific to your individual needs, this may be a better forum for that. So again, at any time, feel free to scan the QR code and schedule that consultation. I do see that we have a number of questions coming in. So with that, I will dive right in. So Dr. Rich, you kind of addressed this, but there's a question as to whether or not you'll still be performing surgery.
Yes, I fully intend to still be performing surgery. And I do think, particularly for the members who are having difficulty with things like bleeding and pain and fibroids and endometriosis, the membership allows me not only to perform that surgery, but also to have a more comprehensive plan for preparing for surgery, recovering from surgery, what to do as follow-up, because these are typically long-term conditions. And while the surgery is very effective at treating them, these are things that, require ongoing care. So I do plan to continue doing surgery. The surgery will be mostly for my members. I will take a few surgical consults per month outside of the membership, but of course I will keep that limited so that I can really focus the majority of my time and energy on my members.
Thank you. And someone is asking, what do you mean by more direct access?
Right. So I think probably some of you who've been my patients for a while have dealt with the frustration of trying to call into the office, and getting someone to answer the phone can be hard in the first place, and then getting that message sent to somebody else, and then maybe you get a PA that answers, and then maybe they send me a message and like it takes a week before I get back to you. This is going to be more direct. Of course, that doesn't mean I'm answering the phone every time somebody makes a phone call. I will be seeing patients and taking care of them. But basically, there are ways through our new system where you can send messages to me. There will be a smaller staff that will directly bring questions to me. And because I'm not going to be crazy running behind seeing 20 some patients per day, I will have time to get back with you sooner and answer your questions and address that follow up.
Dr. Ritch, we have a patient that's asking if nerve blocks are included.
Yes, they are.
We also have a patient who wants clarification on if they can see you without the membership.
So there's really only going to be a couple of types of visits that I do outside of the membership. And that would be those few surgical consultations that I do each month. And then seeing the daughters of my members, as I mentioned earlier. It's really critical that I don't spend a lot of time seeing patients outside of the membership so that I can deliver on the type of care that I want to give for the membership. So, not just anybody can schedule a visit for any reason. It's really just those few surgical consults and my members' daughters outside of the membership.
Thank you. Will the practice offer pelvic floor therapy?
So, we won't have a pelvic floor therapist directly in the practice, at least not yet. It is something that have envisioned in the future down the road. What we will have is that V-tone device, which is excellent for pelvic floor for certain conditions. So it's great for pelvic floor strengthening to help with, bladder symptoms and prolapse and things along that line. It's not quite the right way to go for somebody who's having pelvic pain from the pelvic floor. But I will work closely in conjunction with physical therapists to help kind of direct and communicate pelvic floor therapy needs as needed.
We have a patient who is asking if Sandra will be doing the ultrasounds in your new office.
Yes, she will. I love Sandra, and Sandra is an independent contractor. So she goes to many offices, and we've already had discussions, and she will be the person doing the ultrasounds in my office.
And we have a patient that would like to know where you will be performing surgery, what hospitals.
Right. So some of the procedures that we've previously done in the surgery center can be done in my office. So that's one area. So that would be like the LEEPs, the colposcopies, pelvic floor Botox, some of the hysteroscopies and cystoscopies. I will have an anesthesia team who can come in and give sedation, and there is an additional charge for the anesthesia team, but it's a reasonable charge, typically about $500. For my more major surgeries, I do still have privileges at all of the hospitals that I go to now. So Memorial, West, Miramar, Pembroke, Aventura Hospital. Probably over time, we'll consolidate that a little bit because I do imagine that it'll be a little bit less surgical volume than what I'm used to doing. But at the moment, I have access to all of the hospitals.
Thank you. There was another question about cost, and I'll just take that. So, just to be clear, Dr. Rich's professional fees would be an additional cost. However, if she is performing a procedure or surgery at a hospital, the anesthesiologist, they would be able to bill insurance. Okay, we have a question from a patient who wants to know if you will still be part of
Right.
my
As long as it's a
chart.
hospital that's in network with your insurance.
Yes. Sorry, thank you. We have a patient that wants to know if you will still be part of my chart and to see results in past history.
Right. So our office has never actually been part of my chart in the sense that we've never used my chart as adding information, but any hospital that I have privileges at, I can access the results there. So if there's imaging that was done at Memorial or labs that were done at Aventura, I still have access to all of that.
Okay, someone is asking if the fee can be paid over time, and I'm happy to answer that. We do offer a semi-annual payment plan, so we can split that up into two payments. Yes. Dr. Rich, we have a question for you about is there a cap on the number of visits?
So what's listed in the membership is typically your initial visit with up to 8 follow-ups. The truth of the matter is that, you know, If you need 9 follow-ups, am I going to be counting that and charging? No. The point is that you're going to have reasonable access to care. Some of you, I may need to follow up, a month if we're doing, hormone adjustment, and that isn't always going to be in the office. Sometimes we can do that over the phone. Some of you, we may be doing things that it's going to take a few months to see what the results of that. So it may be a little bit longer follow-up. There's not really a specific cap on the number of visits. I think you're going to have all that you need to get all of the care that you need.
Thank you. Dr. Rich, would you just clarify when is your last day in the present practice?
March 18th.
Thank you. We have somebody asking if they can enroll at any time. The answer is yes. However, I do want to point out that enrollment is being managed on a first come, first served basis. And when Dr. Rich reaches her capacity, she will be starting a wait list. And so we have another question coming in about a cap. And Dr. Rich, would you like to speak to that? Would you like me to take that question? A cap on the number of patients who can join?
Yes, there will be a cap on the number of patients that can join so that we can ensure that I can give the type of care that we're talking about.
So I'm just going to add to that a little bit. Some of you may or may not know that Dr. Rich currently has over 3,000 patients in her panel. So her new practice will be a fraction of that. She will be starting a wait list once she reaches her capacity of 350 members. We have a question here about how is each visit billed. So again, your visits are part of the membership fee. So if you're coming in for an annual wellness visit, that's not billed. That's covered by the membership fee that you pay to be a part of the practice. Same if you were coming in for a follow-up visit. That is part of what you're paying for with the membership fee.
So that means you won't receive additional charges for that. Now, we can help accommodate you with a super bill for the visit that you can submit to your insurance company to ask for out-of-network reimbursement. Of course, I can't guarantee what the insurance company will reimburse, but that is an option that can potentially help offset some of the cost, but you won't be charged anything else for the visits.
Dr. Rich, we have someone who would like for you to elaborate on your HRT program and labs.
Okay, I'm not sure exactly what they mean by that, but I'll tell you how I sort of look at hormone replacement therapy or menopausal hormone therapy. So it's always a very individualized conversation with menopausal hormone therapy. We look at where somebody is in their phase of life, what types of symptoms they're experiencing, what their health concerns are, what their cardiovascular health looks like, what their cancer risks are, what their bone density looks like. So it's a very comprehensive evaluation, and some of the tools that I'll have in the practice with more extensive labs and with the body composition can help us to really get a better approach to that. When I'm looking at menopausal hormone therapy, it always starts with estrogen because, of course, estrogen is the thing that we lose in perimenopause and menopause that gives us so many of the symptoms and health concerns. So it's always a conversation first about, okay, adding back estrogen and what's that going to look like. I tend to prefer the either transdermal or transvaginal ways of giving back estrogen because it's safer and works very well for most women. We add in progesterone for those people who have a uterus or for a few other particular concerns. And then sometimes we consider testosterone for the right patient, depending on, again, what the concerns and what their health status looks like. So it really is a personalized plan when we look at each of those things. I think the question about labs is around menopausal hormone labs. And typically, we would want to get some baseline labs to look at general health, but we don't usually dose the hormones for the most part based on labs. Occasionally, we'll use things like checking an estradiol to make sure somebody's getting good absorption of their transdermal estrogen. And I do monitor testosterone levels when we're giving testosterone to make sure that that's not getting too high. I'm not trying to turn any of my patients into men. We're just trying to make everybody feel better. So we use the labs where appropriate, but some of the places where you may see like doing a Dutch test or these sort of comprehensive hormonal panels, there really isn't any evidence to suggest that that's helpful or useful in any way. So I don't typically use those types of labs to direct my treatment. I hope that answers your question.
We have a patient who would like to know what type of in-office procedures are covered.
Right. So these would be things like endometrial biopsies, colposcopy, LEEP, some of the pelvic floor Botox I can do in the office. The Botox is an additional charge. So typically, where we're seeing additional charges would be for medications or devices. So if somebody needs an IUD or needs Botox, we would order those things sometimes through your insurance if it's covered by there. My services, my placement of the device, my completion of the procedure is covered with the membership. It would just be the additional cost for the medications or the devices. Hysteroscopy, as I mentioned before, can be done in the office, and this can be diagnostic hysteroscopy or sometimes even polypectomy or endometrial ablations. Again, there may be some added charges here for the cost of the devices that I use and for the anesthesia if you're doing sedation, but the work that I do would all be covered under the membership.
Thank you.
Ultrasounds are also included. I don't know if I mentioned that before. So Sandra, yes, is coming to do the ultrasounds, and that will be part of your membership, not an additional charge.
Thanks.
Oh,
We
sorry.
have
And I also didn't mention again the V-tone and the Morpheus treatments. So for that genitourinary syndrome of menopause, the lichen sclerosis, the pelvic floor strengthening, all of that is also included in the membership.
Thank you for clarifying that. Doctor, we have a patient who is asking if you practice general medicine or will be a primary care doctor.
So, I am not a general medicine practitioner or an internal medicine doctor, but as an OBGYN, there's a lot of overlap between what we do and primary care. So, a lot of the sort of basic health assessments that can be done, a lot of the screening, a lot of the like looking at all of these factors of your health, this is very similar to what an internal medicine doctor would do. Now, if we identify something, like for example, we're doing a cardiovascular risk assessment to look at, whether hormone therapy might be good for you, and we find something that shows elevated risk, I'm going to send you to the cardiologist. Like I'm not going to be your cardiologist. You definitely don't want me as your cardiologist. But I think having someone who can take that more comprehensive look and can help kind of coordinate that care and have those conversations with your other physicians, when we look at primary care in that way, that I definitely will be doing.
Great. And that kind of leads into another question that we have. Can you explain what you mean or what's included in the comprehensive physical?
Right. So, of course, all of the stuff that you're used to getting with me at the gynecologic office, like a thorough history, a thorough exam, pap smears when needed, STD screening when needed, looking at hormonal panels when needed, breast exams, slips for mammograms and ultrasounds and MRIs when needed, bone density when needed. In addition to that, they'll be looking a little bit more at your metabolic health. So, this is where the body composition scanner comes in. This is where we may have to do some more extensive labs than typically are done in the gynecologist office. Like when we're looking at things like cholesterol and cardiovascular health, looking at diabetes risk, looking at thyroid function. So this is the type of thing that we're talking about when I mean a more comprehensive exam. Those who have cancer risk, we may want to do some in-depth labs looking at genetic screening or sometimes even some of these newer tests that look for, cancer fragments in the bloodstream. All of these things can be done. Now, the labs as they are processed would be processed at the lab, and those charges typically can go through your insurance. We would draw the labs in my office, decide which panels need to be sent and send them, but the lab charges themselves would be run through your insurance.
Perfect. And we did have a couple of questions come in about how labs are billed, so that takes care of those.
Yeah.
Appreciate that. We have a question from a patient who says they currently do Bellevue and they want to know if there are any laser treatments that will address dryness and atrophy.
Right. So this is where that device that I mentioned, the V-Tone and the Morpheus, come into place. So it is not a laser. It's actually a newer technology that uses a combination of radio frequent energy and, when needed, microneedling. So it does the same effects and actually a little bit more than what the Bella V is currently doing. Um, and that would be included in the membership.
So we have a patient who's asking, they said that you mentioned a mammogram is in the membership, and how does this work? So I'll just take that really quick. Mammograms are a third party service, so that's imaging. And if Dr. Rich orders your annual mammogram, whatever facility you go for that screening, they will be billing your insurance. Dr. Rich, can you explain again about the fee for daughters?
Sure. So, for those who are members, if you have daughters under the age of 26 who need an annual exam, or maybe they just need a GYN visit for something else, but they don't need that more comprehensive, close follow-up. Maybe they're just, coming home from college and need a checkup or something like that. They don't need a membership to be seen if they're a daughter of a member. So instead, that would be where we just do a fee for service visit. So, for example, for the annual wellness exam for the daughters, the fee is, I believe it's $500. And Julie, you can help me
Mhm.
out there if I'm remembering correctly. And instead of paying the whole year of membership, they would just pay the fee for that one visit.
That is correct. We have a question. Is Medicare accepted or all out of pocket? So again, Dr. Rich will be completely out of network with all insurance carriers, including Medicare. But many, many things, including your visits in the office, will be covered by the membership fee. Doctor, we have a question from a patient. Will you be able to prescribe GLP-1s in your new practice?
So I am really excited that that is something that I am planning to offer in the new practice. So I'm undergoing training of how to prescribe the GLP-1s, and I'm doing a lot of research into that and making sure that we do it safely. That's part of the reason I like to have the body composition scanner there, so that we can make sure that if we are using these, that we're keeping your muscle mass up and doing it in the healthiest way possible. And there's a lot of new data and interest in looking at how these GLP-1s may have a synergistic effect with menopausal hormone therapy. So I'm really excited to see, what we can do in that arena.
We have a patient that wants to know if you will still be doing your podcast.
I believe so, although I'm not so sure about this spring season that's going to come up at the time of opening, but I'm going to do my best to get that out too.
And then we have again, kind of a question related, going back to mammograms. A patient would like to know, can you still write orders for mammograms?
Yes, so I will write your prescriptions and orders for mammograms, if needed, breast ultrasounds or breast MRIs and bone density. And then, just like in any other circumstance, you would take that order or that prescription to the place, the imaging center where you've been doing your mammograms and bone density. That would go through your insurance just like it always has. And then the results come to me to interpret. And that writing of the orders and interpretation of the results, and communicating that with you and follow-up steps, that's all part of the membership.
And we have a question about the ultrasounds that are included in the membership, clarifying if they're breast ultrasounds, pelvic ultrasounds, or both.
Pelvic ultrasounds.
We have a question from a patient. Would you be able to continue their care once they become pregnant?
So no, unfortunately, it's been a long time since I've cared for pregnant patients. So yeah, it's been over a decade since I've cared for pregnant patients. So if somebody is working towards pregnancy, of course, I can continue caring for the other issues that we're dealing with. So if we're dealing with pelvic floor issues or pelvic pain issues, then I can continue caring for those issues, but you would need an obstetrician to manage the pregnancy concerns and to do the delivery in conjunction.
We have someone who is asking if medications would be covered through the membership or are they third party. Yes, those are considered third party, so those would still be sent to your insurance. Dr. Ritch, we have a patient that is asking if you will do incontinence procedures such as slings, bulking agents, Botox.
So yes, I do slings and I do bulking agents and yes, I do incontinence procedures. I don't do all of the incontinence procedures. Bladder Botox is something that I may be adding in the future. Currently, it would really just be the slings and the bulking. I also do not do the neuromodulator devices. That would be like the InterStim and the eCoin. Those are things that, of course, Dr. Martin at the Florida Center of Urogynecology does do and can manage those. And that would be not something that would be part of the membership.
We have a patient asking if they will be able to reach you directly once they are a member.
So there are ways to message me directly. And then, like I said, there's a little bit easier access through the phone. Of course, I won't always be available to answer the phone because I'll be taking care of other patients. After hours, we do have through Monarch an after hours virtual urgent care, which is a really great option where for whatever your health needs are, whether they're gynecologic or not, you can call and typically speak with either an emergency room physician or physician assistant that can help address those needs. And if those are specific gynecologic needs, then they will get in contact with me directly and then we'll discuss those. So that's what's available for the evenings and weekends. And then during the day, of course, my team is going to be a much smaller team. And with a little less hectic schedule, focusing on less patients, I should be able to return your phone calls pretty quickly and answer your questions. And then that we do have that messaging available through the electronic medical record as well.
And I think we have time for one final question. Someone is inquiring what happens between now and April 1st before your new practice opens.
Right. So, of course, there won't be any care in the new practice until we open doors. I am still available at the Florida Center for Urogynecology if needs arise. My schedule is fairly booked up, so there's not a lot of elective visits available. But just like always, if you have an urgent concern, it would be either addressed by me or by one of the partners in the practice. And then until that point, the membership won't really start until April 1st.
It's been such an engaging conversation, and I want to thank each and every one of you for coming prepared with such thoughtful questions. And thank you, Dr. Ritch, for your time. I just want to remind everyone that you can reach our membership specialist by phone at 786-228-4284. You can also email us membership@enrichedgynecology.com. As I mentioned before, we are enrolling patients on a first come, first served basis. So I would encourage you to secure your spot in Dr. Rich's new practice prior to a waitlist being started once she reaches her capacity. She has had a very, very good response so far. We hope that tonight has addressed your questions. And Dr. Ritch, do you have any parting thoughts before we sign off?
Yes, and I just want to thank you all again for coming tonight. And I did want to share the vision and the details. And I know everybody gets very concerned about the details, and the details are important about what's involved and is this covered and is that covered. But I think even more important in the details is really the space, right? The time and the space to work together. So, as I said, each membership is going to be a little bit different because all of your needs are a little bit different. And the magic really happens in having that time and space for us to partner together and to follow very closely. So, I want you to think about those questions that I mentioned early, and I want you to just imagine how you could feel and what you could do a year from now if you're feeling totally in control of your health and completely supported along the way. So, if that resonates with you, then I look forward to seeing you at Enrich Gynecology.
So thank you again for your time, and this concludes today's webinar.
Thank you all. Good night.